Hi, good afternoon, friends. This is Dr. Manik Chopra, and I'm an interventional cardiologist at Narayana Multi-Specialty Hospital, Ahmedabad. Today, I'm here to discuss about COVID-19 and heart diseases. As such, in general, I would probably initially like to tell you about something about the respiratory diseases as such. In respiratory diseases, as such, there are two organisms which commonly cause this. One is bacterial and the second is viral. The viral ones are very common and they mostly limit themselves to upper respiratory tract infections. They basically cause cough, fever, running nose, some degree of body ache, and they are routinely self-limiting. By 6 or 7 days, they end off without causing any complications. Chances of mortality are very low, and these complications are mainly seen in immunocompromised patients. Bacterial infections have a traditional course, which is mainly characterized by fever, yellowish expectoration. If it is pneumonia, then probably a pleuritic chest pain, that is chest pain on coughing, and they routinely are due to streptococci, respond to oral or IV antibiotics depending upon the other clinical features of the patient. Now, this virus, as such, COVID-19, or in which we loosely say coronavirus, if we look for the routine classification of viruses, it is basically in the order of family, and then you see the order, and then you see the genus. So it is basically Coronaviridae family, and this is finally into alpha, beta, and gamma coronaviruses. In general, the coronaviruses which have caused infection in human body, around 5 or 6 are being there. The most popular ones are SARS and MERS. SARS is again from China, and MERS is from Saudi Arabia. The origin were from these places, and most of the times you will find animal to human contact, from which it basically starts on. Coronaviruses are basically the reservoirs are animals. Now, regarding this coronavirus, which is also called as 2019 nCoV by WHO, and it is called as SARS-CoV-2 by the traditional viral classification. It is found that it resembles a lot from a coronavirus from bats. Almost 80-85% of resemblance is there, and there is some degree of mutation. Now, where exactly this mutation happened, whether it happened in the intermediate host or where exactly, is very difficult to say and very difficult to find. But it is presumed that once it came in, it has human to human spread, person to person spread, and that is how it has come to humans. Now, it was first found that there are few cases of lower respiratory tract infection which started from Wuhan, and the virus was isolated from that, and it was probably localized to some sort of seafood market in Wuhan, and after that it has gradually spread all over the world. Regarding the contact transmission, I would say that it is mainly by droplets and direct contact and contact. Contact may be direct or indirect. Direct means if you are in direct touch with the blood or mucosal surfaces of an infected patient, thereby infecting yourself, or indirect will be through touching to the same objects which are being used by an infected person. Droplet infection means whenever you sneeze, whenever you cough, you generate small droplets, which may be like more than 5 microns or less than 5 microns. If they're more than 5 microns, they're called as droplets. If they're less than 5 microns, they are basically called droplet nuclei. So more than 5 micron droplets will not be able to travel more than 1 meter, typically 1 meter. And most of us believe that the infection transmits by droplets. So if you are in the vicinity of droplets and when the person sneezes and you get in touch with that either your mucosal surface or your conjunctiva or anything, then there is a chance that you may get it, or these droplets settle down on some areas where afterwards you touch them, then you can get it. Regarding less than I would say 5 micron droplets nuclei, we are not sure whether this would be a main source of transmission in community as such. But of course, for the people who are working very nearby patients, anesthetists who are intubating, or people who are in very close contact of the patients, they may be exposed to the aerosol sort of thing also. Now, there is also some degree of documentation of orofecal transmission, mother to child transmission. One of the cases have been reported, and so these are how these things are being transmitted. So I would say it is mainly by contact and droplet for the time being, and this is how it spreads. The typical thing about the spread of this is it is highly contagious. It stays on surface for hours. It has less resistance to the temperature variations. We need very high temperatures for these things to go off, so it stays over surfaces for hours. Depending upon wood and steel, it remains for 4 to 6 hours easily, maybe 12 hours, and that is how it is more contagious. At the same time, many of the patients are completely asymptomatic, and or they are very mildly infected. So these are the patients who will be spreading the infection in the community, because they are very mildly affected and they are not restricted, so they spread it very fast. So that is why it has been spread very fast. Traditionally, it is from the travel and other things that it has spread so fast from China to other places. But now, once you reach in a stage of community spread, then probably it's within the community and then it multiplies exponentially. So this is something regarding the spread. Regarding the treatment, I would say that there are two parts of such contagious diseases. One is treatment and prevention. Regarding the treatment part, if you have symptoms of flu, whether it is due to coronavirus or whether it is due to seasonal virus, if it is very mild, they at most need to be monitored and monitored for worsening. If they are severe enough, you need to go to the hospital, get admitted, and get yourself treated. This is something which is very standard, and I think we don't need to discuss much in this. The only part is how it differs from the coronavirus treatment part. How it differs, again, it is mainly supportive care, and there are standard guidelines which are being led by every local body to how to treat depending upon their resources. Now, second is about the spread part. Now, the spread part is again divided into those patients who are already positive for corona. Second, patients who are or contacts. Second group is contacts who are symptomatic and were in contact with positive patients. Third are patients who are asymptomatic, people who are asymptomatic but were in contact with corona positive patients. And fourth are patients with just flu. Now, all these four patients as such would need some degree, they would need isolation. Now, what facilities they go in depend upon the local resources available. It varies from if the patient is very sick, he goes to a isolation ICU. If the patient is symptomatic but is rest of all is okay, then probably corona positive will go in a ward, isolation ward, or isolation rooms. And if the patient is asymptomatic or just has asymptomatic contact of corona positive patient or patient with just mild flu symptoms, he may be monitored at home isolation or home quarantine sort of thing. But this categorization, which patient goes and where, depends upon the local resources per se. And and uh, and then they have to practice isolation clearly, because this is how you will be able to prevent the spread to the community. So you will have to contain yourself to probably a single room. You will have to maintain a distance of at least 1 meter from your relatives if possible, within the room. Your food should come within the room. Your utensils should be within the room. Your clothes should be within the room. Once they are dirty, they should be again within the same room. Your washroom should be isolated, and you should be maintaining hygiene well of yourself also, as well as cleaning up your clothes, your utensils, the surfaces where you touch, and other basic hygiene. Everything will require some degree of detergent or some degree of disinfectant, depending upon again the availability of the same thing. If someone is taking care of you, then he or she should be wearing, and you should be wearing a mask if you're not within the room and you are getting exposed to other family members, preferably an N95 mask. If some relative is going to give care to you, he should again be wearing an N95 mask. Both of you should be washing hands frequently. You should be maintaining good amount of distance in between. Respiratory hygiene, hand hygiene, not to touch face. All those things will again apply, so that you don't give it to your family, and you remain restricted to one room. And the same sort of things are being practiced at the hospitals also, but they are much more stringent, I will say. So this is how you can contain the disease within yourself, and probably a period of 14 days minimum would be a reasonable one to go in. But again, depending upon what sort of facilities are available for diagnosis part, will depend upon when you come out of the quarantine part, or your home isolation part. And regarding the patients who are completely asymptomatic, now the idea is, do not go out, maintain social distancing so that you don't get it. And if you have it in the asymptomatic phase, you don't spread it. If you are going out, maintain a distance of 1 meter at least from every person, whether it is infected, not infected, coughing, not coughing. Uh, Try not to gather at places. Whenever you come back, if possible, if you're going to a hospital or a place where there is a lot of crowding, it would be a wise idea to wear some degree of protective mask or some degree of face mask. If it is available, even a surgical mask would be a good thing to go with. But in general, I think it all depends upon whether it is available with you or no. But at least maintain 1 meter distance. When you come back, you can dispose of the clothes directly to the wash, and I would say, during sneezing, you should cover your face. You should always wash your hands before you touch your face. You should not touch your face without washing your hands. You should eat food after washing your hands. After going to washroom, you should maintain cleanliness over places which are being touched by every person, like handles, washroom handles, taps, and other things. So this is how you go about your own safety, and if you're at all in a asymptomatic phase, not giving it to the community. So uh, uh, I can read about the symptoms, as I already told. That is basically uh, fever with cough or with dyspnea. This is the classical triad which is being given, but there can be variations in this. And traditionally, it was said, initially it was history of travel within next last 2 to 3 weeks to an area which was having an epidemic of coronavirus. But now more and more positive cases are coming in, so close contacts or transient contacts of the patients also may get these symptoms. And so basically, these were the patients who were being screened by diagnostic tests first. And regarding the diagnostic test part, I would say that it is basically again for diagnosis as well as prevention. If you diagnose more and more, you can isolate more and more, and you can prevent the spread more and more. But it all depends upon logistic and the strategy which a country adopts. And Of course, patients with previous heart diseases, especially those who have weak heart, I won't say that they are at higher risk of getting infected, but for sure, if they get infected, chances of them getting severe symptoms or getting complications are higher. So in those patients, I would say that they should they should practice. They should take their medicines as usual. There is no reason to stop the medicines. They should get their supplies as they are getting regularly. There was some scare about ACE inhibitors and ARB2 inhibitors, but they should continue taking them for hypertension as well as for heart failure. And they should practice their regular things like healthy lifestyle. They should eat more fruits, vegetables, drink a lot of fluids, meditate, do yoga if possible. I won't say that they should be going for jogging or walking if they were doing it earlier. And I think rest of all the precautions which were discussed earlier will also fall in them. If they are getting symptoms, then they should report it at earliest because they would need monitoring for these symptoms. Same is also true for diabetes patient. I can see that probably someone is asking about diabetes. Then yes, such patients, uh, such patients, such patients. I mean, again, they are not at high risk of getting infected, but definitely the chances of getting complicated are slightly higher. Okay, so in those patients also, the principles remain just the same. Control your sugar, have great food, exercise if possible at home, lot of fluids, and maintain hygiene, respiratory hygiene, social distancing concepts, and all those things still apply to them also. And if they are going out to a hospital due to any reason, then they should be wearing a face mask if it is possible. If and there's a lot of questions about face mask and hand sanitizers. Hand washing is very important and is probably equally effective and more effective than sanitization. So if you can wash your hands frequently, that would serve the purpose. And regarding the mask, again, it is basically to prevent the spread from outside to you. So if you can maintain a distance of 1 meter, then probably it would it would be okay, unless and until you are going to a place which is very crowded, or you are going to a place or to a hospital, or you are going to a person who is already infected. So those people, I think, uh, would be you should be wearing a face mask. N95 mask is a mask which will allow N95 mask is a mask which prevents 95% of prevention from droplets which are less than 0.3 micron in size. But and a surgical mask is a three-layered mask, so the outer one will prevent the droplets. The inner one will 90% of droplets less than 5 microns cannot come in. So it is also equally effective. I mean, say it is definitely lesser than N95, but will also give you good amount of protection. And none of these will guarantee you that no infection will go in, but of course the chances are very less. And you should use a N95 mask without a exhaler, because then the barrier is broken. And I think I have addressed many of the questions which were already being asked. So regarding the pre-existing heart valve disease, I think uh, again the same thing. You should be on your medicines. You should not stop your medicines. If you are on ACE inhibitors, ARBs, continue your medicines. Maintain the fluid balance which you were taking earlier. Keep eating good food. Meditate. Keep your mind clear of all the doubts. Try not to go out. Maintain social distancing. Maintain hand hygiene and all the other things which I already advised earlier. So, 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 so this is, I would say, is about the heart patient. I already explained about the diabetic patient. I can see, is it mandatory to wear mask in all the categories of people? Again, I answered this. it is not mandatory to. I would say that if you are staying at home, there is no point wearing, if you are asymptomatic, and if you are wearing at home, you are at home, there is no point wearing masks unless and until any one of your family members is infected. If you are going out, maintain a distance of 1 meter. Of course, if you are going to places like hospitals or a place which is crowded, or you are in near contact to a positive patient, then it makes sense of wearing a mask. If you have N95, that is great. If not, then a surgical mask will do. And I think that is how I can answer this question of wearing masks. Every patient who is every patient who is having flu-like symptoms should be wearing a mask, preferably N95. If not, then a surgical mask, so that the infection doesn't spread to others, whatever it is, whether it is corona or whether it is a seasonal flu, whatever it is, the spread has been prevented. And then whether the corona can spread from fruit or vegetables, yes, of course. If there are, if you're getting it from outside, and if someone has coughed or sneezed near that area, and if there are droplets over it, of course it can be a source of infection. So it should be washed before you consume them, probably it should be washed very thoroughly, and then you have to cook them thoroughly. So if you cook them thoroughly, then the chances that anything goes with it is very less. But if you are eating something which is brought from outside completely raw, unwashed, then you have to think about it. Then I can see something regarding hydroxychloroquine. It has nothing to do with community. It is only to do with healthcare workers. So there is no need of discussing that. And so this was about chloroquine. And so regarding the lockdown, yes, this is a period where where we get time to isolate non-infected patients from infected patients, and thereby we prevent the spread in the way that it spreads exponentially. We all have seen many videos showing things multiplying exponentially. That all will be prevented. So the curve of the number of infected patients as such flattens. Once it flattens, it becomes easier for the government to handle the patients, because their healthcare facilities are not being stretched off. At the same time, number of patients infected at one point of time are less. And I can see regarding the incubation time of COVID-19, it is as short as, probably commonly it is from 3 to 14 days, but as short as 1 day also can be considered. And I think this is all which is important to know. And I can see other questions also coming down. So there is nothing like foods to be avoided, but I would say that everything should be cooked well and it should be consumed warm. There was some degree of scare about the intermediate hosts, whether it is what would be the intermediate host in between animal and man. We don't know. But of course, even if you are consuming some non-vegetarian food or eggs, it should be cooked very well, and it should be hard-boiled eggs which should be consumed. So I don't think that there is anything which should not be consumed. Of course, you should not be drinking things which are to which you are allergic, or to which you are sensitive, which makes your surfaces more raw. So I would say drink a lot of water, eat well cooked food, and yes, that is more important. Someone is asking regarding exercise and jogging has been walking and jogging. So you can do any sort of exercise or yoga which is possible at your home, and I think that would be great. Aerobic exercises would be better for patients who have poor heart functions. I won't advise weightlifting and others these sorts of exercises at home, but yes, yoga and aerobic exercises, aerobic uh, or running on a treadmill would suffice. So regarding someone has is asking regarding reinfection, chances of getting reinfected for the time being, I am not in a state to exactly elaborate because this is we are all learning what's all happening, but chances that patient gets reinfected very early again are very less because definitely there is some degree of immunity which is being imparted. And then someone is asking regarding airborne. So I told you, once you sneeze, there are two types of particles which are formed: more than 5 micron, less than 5 micron. Less than 5 micron is droplet nuclei, and more than 5 micron is droplet. When you sneeze more, it is more than 5 micron, it can spread up to 1 meter. When it is less than 5 micron, it can spread more than 1 meter. So when it is less than 5 micron, you call it as aerosol, and that is how airborne things spreads in. But in general, for the time being, it is believed that it is mainly contact and droplet. It is not airborne for the time being. Yes, of course, aerosols, if aerosols are formed, they are only important for people who are taking care, for example, nurses, anesthetists, doctors who are intubating, or doctors who are getting nebulizers, doing CPRs and all those things. So it doesn't come to the public domain as such. If you are making a visit to a hospital, I would again say you will have to you should wear a if you are visiting to a hospital which is accepting COVID or flu patients, then you should take precautions of wearing probably N95 mask, or if not possible, then a surgical mask, because it is as probably slightly less effective, but it is also very effective. And maintain hand hygiene. I will say maintain social distancing. When you come back, you wash your hands, remove your clothes, drop them into a wash area, and that's it. So I think so regarding the heart, I think there is nothing which needs to be done extra from our side. Whatever exercises we were doing, rather than going out, they have to be practiced inside. Whatever precautions you were taking earlier have to be taken now. Whatever medicines you were taking earlier, you have to take it now. The only thing is that you need to be calm. As all the other patients, all the other people, you have to accept the concept of social distancing, and you also have to uh, maintain hand hygiene. So these things also apply to them. The only thing which is extra to them is if they are developing any symptoms, then they should be taking care of those symptoms at earliest, because because those are the ones who can get complicated. So it's not that they are at higher risk of getting infected. Once they get infected, the chances that they get complicated are higher than usual, especially diabetics, hypertensives, heart disease patients, especially with weak hearts or with low ejection fraction, patients who are more than 65 years. These are the people who are at more risk of getting severe disease. It's not about getting infected or not infected. It's about once getting infected, getting the disease severe or not. So those patients, if they are getting mild symptoms, again they have to be under supervision with someone. Nothing else needs to be done except for taking warm liquids, lot of fluids, gargles, some symptomatic medicines at home if it is very mild. If it is more than mild, of course, you will need some degree of treatment and you will need to go to a hospital where flu patients are being accepted. I don't think this is. I mean, vaccines are far off. I'm not an expert in that, but I could probably think that they are at least more than 6 months ahead. That if we get a vaccine, I think regarding corona-related information, you have Ministry of Health and Welfare website on which most of the things are being updated regarding the public domain and what all activities they are doing at the ground level as well as in the hospitals. So I would say that would be the right place to look for information because that information applies to all of us. So, eh, whether babies can get an infection or no, yes, of course, but chances that they worsen are very less because they are. I mean, regarding kids as well as younger population, it is found that the chances are lesser that they go to severe, unless and until they are low body weight or they are immunocompromised or something which leads to a low immunity or they are diseased or suffering from any other disease, which also holds true for the elderly population. If the person is having renal disease or liver disease or heart disease, then his chances of getting severe infection are more. It's not about getting infected or not. Once getting infected, getting severe complications are more. I think that answers most of questions. And let me see if I can find any other question. Only coughing can be due to COVID-19. Generally, it is fever with cough and or dyspnea. But yes, if you go to handbook of a Chinese manual, sometimes very few patients had just chills, not fever. So yes, but definitely some degree of inflammatory response, general inflammatory response is expected. So regarding the babies and younger population, as I already explained, the risk of infection remains the same. The chances that the disease remains mild is much more higher in younger population, unless and until there is other comorbid condition like very low body weight, or if the person or if the baby is suffering from any other problem. I don't see any new question as such for the time being, so all right. So I think I have addressed most of the questions. So I can conclude that the best way as a country we treat is we all maintain social distancing and we maintain hand hygiene. We maintain uh, an isolated sort of life which we are living for the time being, staying in our home, keeping our moral high, maintain social distancing, maintain hand hygiene, washing hands repeatedly, covering our face with elbow while sneezing, washing your hands before you take food, washing your hands before you touch your face. Do not touch your face without any reason, and maintain the basic hygiene which is required in home also, so that the thing remains contained. As a community, I think we need to act together to prevent the spread. If we prevent the spread, then chances that people who are infected are less. Anyways, many of the patients will be mildly symptomatic, will not require much. It is just about those who require severe symptoms, who require hospitalization. And let's hope that we all pass this time. And I can only say that all of us have strength for today and hope for tomorrow, a better tomorrow. Thanks.